Hi, I'm Susan Taylor at Scripps Health in San Diego, California. So you're a runner. You run 10 to 15 miles a week, you're in great shape, you run the occasional half marathon, but then you start having hip pain. And there's really no reason for it because you didn't fall, you didn't have a traumatic injury. So why are you having all of this pain to the point that you can't even walk? Christine Burke had been experiencing serious hip pain for years. A personal trainer and an avid runner, she attributed her discomfort to overuse. But not so fast. Christine joins us today, along with Scripps orthopedic surgeon, Dr. Rina Jain. Thank you both for being here. So Christine, what happened? You didn't fall, you didn't trip, there was no traumatic injury.
No, it's just that when I started running late in life, actually, and I noticed that there was just minor hip pain now and then sometimes it would be worse, and sometimes it would be better, and I would learn a new exercise or get a new pair of shoes, and it would get better. And so you don't think about it too hard, but then over time, it just finally got to a point where, you know, it just wasn't getting better and it was getting worse, and it hurt to land on the foot.
But you did stretching and you did physical therapy?
Yes, there was lots of exercises to strengthen the hip. And so it's not that I was in constant pain for the whole time. It's one of those things that would kind of move in and move out and come back. And there was I remember one time where it was like, oh, I don't think I can run anymore. But then I got a new pair of shoes and it was all fine. So it was one of those things where it had been bothering me off and on for so long. But then when it got worse, it was like, okay, I think I need to do something else.
And then there was that trip to Disneyland.
Yes, so it actually got very bad. So I got my X-rays, I got my MRIs, and they were showing that it was just all torn up in there and really, really bad. And then there was the trip to Disneyland where I was walking around Disneyland, and it hurt to walk. And I'm like, this is not cool that I can't walk around Disneyland without really enjoying it as much as I should be. So that was kind of when it was like, all right, I think I actually have to consider the surgery at this point.
So Dr. Jain, what causes hip pain? And maybe you want to show us on the model that you brought?
So we have a model of a pelvis, which is right about here. The hip is a ball and socket joint, and this is the socket part of it. And normally we have a ball as well. And this has just been cut out. This is the thigh bone, and there's a ball that fits right into it. So what happens with arthritis is that you get bone rubbing on bone. So the ball of the hip joint rubbing on the socket, and instead of smooth cartilage rubbing on smooth cartilage, you have rough bone grinding on rough bone. So what happened with Christine was, I think that when you were born, or very early when you were a little baby, the socket part of it was missing, and that's what we call hip dysplasia. We don't know why it happens. It tends to happen more in women, but you were not born with a normal shaped hip. So over the years of doing all your great exercise, the hip was kind of pounding on that area, and it wore out way faster than expected.
I'm saying because you're young. I mean, you think that someone Christine's age would not be a candidate for arthritis that early in life.
Exactly. She is very, very young. So that's why we were looking for what is the cause of this. And when we got into the surgery, it's like, oh, you were born with a really abnormally shaped hip in there.
So hold that thought, because we're going to talk about arthritis in the hip for older folks, for the baby boomer generation, and is hip replacement surgery the answer for that age group as well? But we'll come back to that in just a second. So osteoarthritis, what is it? How do you treat it?
So osteoarthritis means that the cartilage which lines each joint has worn out, and then you have bone rubbing on bone or bone grinding on bone.
And how do you treat it?
Many different ways. You can start with simple things like anti-inflammatory medications, Tylenol, physical therapy. If none of that works, then surgery, and it often means joint replacement.
How has hip replacement surgery changed over the past 20 years? It's a lot more high tech.
Yes, it is. Hip replacements have improved dramatically in terms of the actual surgery experience. We're making our incisions much smaller. I remember in the old days when I was a resident in training, the incisions or the cuts that we would make on the hip would be 12 inches long, and now we're getting them down to 4 to 6 inches. We've also improved in terms of blood loss. Patients hardly ever need a blood transfusion anymore with this type of surgery. We've also made huge improvements in managing pain after surgery with physical therapy. Patients are now getting up on the day of surgery. They're moving around so much faster. People are now staying in the hospital maybe 1 to 3 days at most instead of like a week or two like they used to in the old days.
And so, Christine, what happened when you had the surgery?
Well, the surgery was, that was a big deal.
I'm sure.
It really actually helped to have a lot of upper body strength because you can like hold on to things and help your walking out. So I was pretty functional right away, and then it was just, you just learned how to walk all over again. And but surprisingly, I was walking the day after. I was walking up the stairs the day after the surgery. So
that's pretty incredible.
Yeah, I thought that was pretty good.
Now, is that common, or is that for someone who's in great shape because she happens to be a personal trainer and this is her livelihood?
Yeah, I think, well, Christine is exceptional. yeah, Christine is exceptional because she is so fit to begin with. That's why her recovery was great. You left the hospital within a day. That was absolutely amazing. But with most hip replacements, we do try and get patients up on the same day with a walker, kind of walking at least a few feet. Of course, again, Christine's the exception. She was like right out the door.
Can you show us the new hip?
We'll show you what we implanted right in you. So this is the socket, and it is made out of titanium. And inside the socket, we put a plastic liner. It's a medical grade type of plastic, and it snaps right in there. Then we put a ball, and the ball is anchored to your thigh bone or your femur bone. And now you have a smooth metal ball rubbing on plastic. So instead of rough bone grinding on rough bone, it's smooth metal rubbing on super smooth plastic.
So for someone who has hip dysplasia, she had it on this hip. Would she have hip dysplasia on the other hip as well?
Oftentimes it is
Maybe
on both sides.
And when you take a look at this hip replacement surgery, how long does the new hip last?
Typically, hips are lasting 15 to 20 years. With this particular brand of hip, it is reported to last 30 years or longer.
30 years. Yeah. Well, that's good.
I think that's great. I was very excited to hear that.
But the hip will last longer. Well, one of the things that people say, and I know that this was a question in your mind, you thought, oh, I've got the hip pain because I run a lot. And is running, necessarily a great thing for you, or does it cause more problems down the road?
Yeah, generally we do try and tell people avoid what we call high impact activities like running, jumping, marathon running. And the reason is eventually this piece of plastic will wear out, just like tire treads wear out after 50,000 miles or whatever. The same sort of concept applies to this. And that's why we give people an estimate. Well, we're thinking 15 to 20 years. And with this particular brand, we're hoping 30 years.
But if someone is a runner, for example, so Christine, would you say you're going to run less from here on out?
Yes, I told her I was going to run. And she's like, all right,
she's
you
a
runners,
runner.
I know you're going to run. So, but I am really limiting how much I run. So I'm really trying to, I gave myself an arbitrary number of, you can only go this far in any given week and in a given day. And that's just to limit the actual impact.
Wearing out of it.
Yeah, just to wear it out. So it would be great if this lasted 30 years. I'm guessing it'll last a little bit less just because I like being active. But it's cool because I can still do a lot of things now. The biggest problem for me was that I couldn't walk anymore without pain. Whereas I'm actually walking, I'm walking very well. So I'm signed up for a 10K and I will be walking most of that. I'm thinking I can actually run a whole 5K, which is only 3 miles. Very excited about being able to continue these activities, and being younger. That would be like a long time not to be able to do these activities. So, I actually plan to continue half marathons and hikes. I'll just be walking a lot more. It's really too bad because the running's going so well that I'm like, oh, I want to do more.
But Dr. Jain, running is not bad for you. We want to make sure that people understand that.
Right, exactly. And then Christine is being very, very diligent about being careful with the amount of running that you're modifying your activities. But the whole point of doing the surgery was to get you back into life and living.
Yes.
What do you do, Dr. Jain, if you have hip pain?
I think first thing, of course, is go see your doctor. There can be many different causes of hip pain, and they're not all related to arthritis. Sometimes it could be a pinched nerve coming from the back. It could be any number of things. So definitely see your doctor and start a conversation, have the doctor examine you, and then maybe there might be some tests that need to be done.
And then how long, I mean, how long should you go if you have hip pain? Let's say you have hip pain. If it comes on without any reason, do you wait a week or two? You know, you try the anti-inflammatories. What's kind of the time progression for when you should actually go seek medical treatment? I
think it's very, very individual. If the pain is so severe that somebody cannot walk, I think you need to see somebody immediately. But if it's sort of just like a little pain thing, you know, maybe it's a strain, or maybe I just did too much activity. I think, like you said, go ahead, take some anti-inflammatory pills, rest it, and see if it gets better. So it's very, very highly individualized.
And what about exercises after your hip surgery? What should you do and what shouldn't you do?
Well, I think generally speaking, you can pretty much return to most activities except the high impact loading activities that we were talking about. But otherwise, the sky's virtually the limit.
It really depends on what the person wants to do and how well they're progressing. So I work with a physical therapist, and I have lots of trainer friends, so I had them spot me and make sure my form is correct. So it really depends on how well you're doing. I actually encourage most people, you want to get in shape in general, because if something does happen, you can get back into shape much sooner.
A lot faster.
Yeah, and the more things you can do before surgery, the better you're going to be able to keep those activities afterwards. So not everyone can run after a hip replacement surgery. Not everyone can do squats, or not everybody wants to.
But you're doing squats
but
now,
I am
right?
doing squats.
You're doing lunges?
Yes, I'm doing lunges. I'm doing most of. I'm actually doing most of what I was doing before, which makes me really happy. I'm not. I just not doing like the jumping, not doing the jumping.
So how long after the surgery were you able to get back to your normal routine?
I think I was going back to work, just working a few hours in about 6 weeks. So it was like the first month of surgery. It was, with like all the medications and everything. That was actually the hardest part for me personally. But I was itching to move around, so that came much more quickly. And then there's parts of the body that take just longer to heal. So me and my physical therapist are still working on that.
Dr. Jain, we talked about it before, but what about arthritis in the hip for older folks, for the baby boomer generation? Is hip replacement surgery the answer for them as well?
Sure. If they have not found any relief with medications or using a walker or physical therapy, it certainly is. Our technology has improved over the last many years. The way we take care of older patients who might have some medical problems has improved. So yes, it can give them a tremendous amount of relief and dramatically improve the quality of life.
So how's life now, Christine?
Oh, I'm excited. I'm happy. I just got back from Yosemite and went hiking, and I'm set up to go to a race in Arkansas, the Little Rock marathon and half marathon, and then I've got lots of plans, and it feels good.
And when are you planning to go back to Disneyland?
Oh, Disneyland. We are definitely. We'll probably make it to Disneyland within the year, but we're definitely planning on. There's the Dark Side races in Disney World that we are planning to hit as well. So it's So
Disneyland life is pretty much back to full speed for you.
Life is full speed ahead always. It's always.
Dr. Jain, what is the hope that you have for all of your patients?
Well, I hope that all my patients get back to mobility, going to Disneyland. The best stories I get from patients are, I took my family to Disneyland and I was able to last the entire day without pain. It's like, that's all the reward I need.
Any final thoughts?
Final thoughts. I'm so grateful for this. For the surgery. I'm so grateful for all the care that I've gotten and all the, because I really did do everything before the surgery. I mean, we did everything before the surgery that we could, and I'm so grateful that we're at this point where I can recover quickly. And I think someone asked what has changed the most about your life after the surgery, and I still think the best part is nothing much has changed. So
you get back to normal.
So yeah, it feels
normal's
good. It feels good. There's the general getting age, the getting older thing that's not so fun. But yeah, everything does feel like it's just there were things that I thought I'd have to give up, and I don't have to.
Any final thoughts, Dr. Jain?
We just want to keep everybody happy, healthy, and active. Just get back into life, and that's why I do this.
Thank you both so very much for being here. We wish you continued good health, continued good walking and running and hiking. Thank you, Dr. Jain, so much.
Thank you so much.
You.
And thank you, Dr. Jain.
Thank you for being here.
Hip replacement surgery is among the most common surgeries in the United States, and Scripps surgeons perform more than 3,000 hip and knee replacement surgeries each year. That's more than any other healthcare provider in San Diego. Scripps is repeatedly ranked by U.S. News & World Report as #1 in San Diego and among the tops in the nation for orthopedic care. If you would like more information on hip dysplasia and hip replacement surgery at Scripps, just click on the link. And if you want more critical information about your health, please subscribe to our YouTube channel and also follow us on social media at Scripps Health. I'm Susan Taylor. Thanks so much for joining us. It's our mission at Scripps to help you heal, enhance, even save your life.